Welcome in to The Real Matrix. The Angry Patriot, along with my, which I consider my very good friend, Mr. Dale Hellestray, who's coming along basically for the ride. I'm forcing him to do this. I think that's what friends do to other friends. They force them to do things they don't want to do. I'm hoping, though, Dale is seeing or opening up his eyes because before you started this, you were unaware of all this, as I was unaware of all of this before COVID hit. We both did a sports talk show, and politics and life and business and all of that stuff was something I didn't concern myself about. I could care less. And Dale shaking his head, I imagine you're probably the same way. And you are still much more that way than me. But is this starting to, I don't want to say open your eyes, but
well, it is. It's opening my eyes. It's giving me food for thought. It's not as wacky as sometimes I think things that come out of your mouth are. And you've got some proof. You got some things that, again, you can't dispute a lot of the things that you're bringing to the table.
Yeah, this is just factual information that is withheld generally from us. Or if it's not withheld, it's just something you have to search down. And we as people, we're so busy with our lives, are just keeping up with, work and kids and family and enjoying our free time. Who has time to really actually learn about what's affecting our lives? Because I know before COVID hit, I was like, listen, I'll let these experts, I'll let the people in government, I'll let the people in health, I'll let them worry about this stuff, and then they'll tell me. Basically, I was sheep. I was a sheeple.
Yes.
And I was just, people are looking out for my best interest. And until COVID hit, then I realized, wait a minute, my best interests aren't locking down and staying at home, not going to work, not congregating with family and friends. That's not my best interest.
Right.
If I'm not worried about this illness that is going around and people would say, hey, I got COVID. Be careful. I didn't catch it around you. Is it airborne? What is it? What's happening to that? And so the whole thing about COVID really started this venture with me in regards to waking up. And we've done a lot of shows, and we've talked about a lot of the criminals behind all of this. But really what started for me was COVID. And I still talk to people. I talked to your good friend Bruce Cooper, talked about COVID, and he was like, COVID was manufactured. COVID was a man-made. It just wasn't a deadly illness that just came out of a bat cave and happened. And then these shots are for my good. These vaccinations help me, and they don't have any side effects. And he's someone I consider, kind of halfway smart.
Right. Well, I think he's probably a lot like you and I in the fact that up until a certain point, our lives were good. We just went along our business, and nothing really affected us negatively or positively until this hit. But then once you start delving into that like you have, then there's other things that start coming up that make you really shake your head.
But so I want to go over like the beginnings of information on the behind COVID and kind of wake people up, because I would think in 2025, if you don't realize COVID was manufactured, was thrown on us on purpose as a bioweapon, and as the same with these vaccines, most people I would think already know that or should know that. But if you don't, this is the show to watch. And if you do and you're bored by that, watch this. This is information you can use to wake up the other people who are unaware that this wasn't just some random act of nature coming up with this bad illness that got us sick and killed some people. So let's start right now with, there's a clip from Mike Yeadon. He was a ex-vice president of Pfizer. And so he's deep into the enemy territory. And listen to him, what he says about COVID and the vaccines coming up.
My name is Dr. Mike Yeadon. I left Pfizer in 2011. What we were being told about this virus and what we needed to do in order to stay safe was simply not true. So it's not just a matter of disagreeing professionally, it's just complete nonsense. And we can certainly talk about the unreliability, untrustworthy nature of PCR testing. Everything your government has told you about this virus, everything you need to do to stay safe is a lie. You should disregard all announcements about case rates in your community. They're not telling the truth. And if they're not telling the truth, that means there's something else afoot. And I'm here today to tell you that there is something very, very bad happening. And if you don't pay attention, you will soon lose any chance to do anything about it. And don't say you weren't warned, because I've been warning people as long as I can and as hard as I can that governments around the world, and certainly yours locally, is lying to you in various ways that are easy for you to establish.
So what you see there at the end of the clip, 33, and that's the Freemasons. They have a 33-degree Freemasons. I don't understand how Freemasons work. I think they're just the very quiet elite that are at the top of decision making in our worlds, in our government, in our corporations. We touched on that in other shows in regards to the Bush family and them being associated with these groups, these secret private groups.
Clubs that we're not a member of.
Correct.
And probably will never be invited to.
I know I'm not. Dale, you hang out with those kind of folks. You might find yourself in one of those meetings. Just be careful, though, because generally in all those meetings, to be able to get into there, you have to dress up like a woman. You have to be embarrassed. You have to go through these rituals. We'll show that in later shows also. But so he talks about how government's lying to us, media, government, whatever it may be. And I want to show a clip. It's just about a minute clip, but I have 9 minutes worth of information from not only America, but throughout the world. And you're going to hear the number 33 repeated constantly. Now, it might be a coincidence that when COVID hit, everyone that got sick added up to the number 33. Might be coincidence, but you watch this clip and you tell me if it's coincidence or if this isn't a push propaganda, evil tricks on our society. Play this clip. Listen closely.
We have 33 confirmed positive tests.
We have 33 Pennsylvanians who have tested positive for
COVID-19.
Today we have 33 cases.
There were 33 new cases.
The state of Minnesota today reported 33 new COVID-19 related deaths.
There are 33 confirmed cases in Arkansas.
That's the largest single-day increase so far, raising the total to 33.
33.
There were 33 confirmed cases in North Carolina.
33.
There was 33 everywhere. I think that was Red Team Go. I think 33 is like Red Team Go. Everybody goes, okay, let's do it. It's time.
Yeah, 100%.
Dude, there's like literally 1,000 33s and 33 new cases. 33 people died in fucking Hong Kong.
The number 33, we all know what that represents. Everywhere, every single day, it was like, well, 12 more cases, which now brings the state to 33.
Yes.
We had 33 cases today.
Yes.
We had 11 cases, which now it's 33. 33 more people. I'm going, oh my.
Any comments on that, Dale?
Well, what's interesting is obviously if you live in Minnesota, you only see Minnesota.
Correct.
If you live in Arizona, you see Arizona.
And you saw, if you were watching the screen, throughout the world in Bangladesh and Nepal and blah, 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 33 everywhere. And this is a friend of mine who is way more knowledgeable than me. I call him the mailman. Why is the mailman? Because he delivers the information. Okay. And the mailman says, Geez, what does he say? He says that.
Well, what was interesting is when he said that one guy said 33. I think that is go time, or that's red time, or that's a signal, or
that's a coordinated message. That is a coordinated message
to who?
Us. That because they believe in this higher power that 33 some magic number. So with 33, they're pushing that information out to us.
So you're telling me that you don't think there are only 33 cases in 1,000 different places?
What the mailman says, symbolism will be their downfall. Symbolism.
Okay.
They're very at 33. If you're aware, if you see. In regards to symbolism, think about this. We did the shows on 9/11. Why did they pick 9/11 to have an attack? Because when you have an emergency in America, you dial 911.
Right.
9/11. That's symbolism. These evil, satanic bastards out there are very use symbolism.
Okay.
So be aware of that. They've said it. They do it. It's not like it's a secret. As you see here, if you are aware, you go, well, that doesn't make any sense. There's 33 everywhere.
No.
But if I tell someone, yeah, this is an agenda. They're telling us lies. If you don't see it, my words are hollow. But you have to see it from their words, from their mouths, and you go, or at least I would say anyone with half a brain would go, that doesn't make any sense.
No, because you at least 4 or 5 different states there, and then around the world, and whatever. That's shocking.
And like I said, that was a minute. Yeah. I could give you video after video after video of more of the 33s.
And 33 is a symbol for Freemasons.
It's the 33 degree something. Listen, you as listeners, you have your phone, your computer. You can look all this up. Look, Freemasons, 33 degree of Freemasons. It's that those are when we talk about the deep state, the Illuminati. You can talk about Freemasons, 33. All of those people behind the scenes who you don't know their names. They are in power, and they work behind the scenes, and you don't know who they are. Why it's always, and that's how they get things done. Because if you know who's saying this, if you know who is in charge of this message, you would want to string them up and hang them, correct? Pretty much. So I want to get to, again, in regards to COVID, who took over our care of our vaccines? It was Bill Gates. Bill Gates, a computer nerd, was in charge of our vaccine program. He was the voice. He was the pushing through the media of these COVID vaccines. He said, people need to get them. Everyone needs to get them. But as we go on through COVID, after years and years where early on in COVID, if you said, don't get a vaccine, they're dangerous, they're this, they're that. If you said that, you were deplatformed. Your voice was silenced. And in this next clip, Jimmy Dore, who's a comedian and an online guy, he talks about what Bill Gates says, who was behind this push for vaccines, who later says, So play this next clip.
We didn't really understand the fatality rate. We didn't understand that it's a fairly low fatality rate and that it's a disease mainly of the elderly, kind of like flu is.
Do you hear what he's saying? And it mostly affects the elderly. And he said it was like the flu. That's what he said. Now, if I said those things, they'd take my channel down on YouTube. And this is what we ruined everyone's life over. And now he's admitting it.
Hey, that was the message early on. Lock down. Shut your business down. Don't meet with people. But the guy who is the largest investor or supporter of the WHO, the World Health Organization, who is basically, and Gavi, which is a vaccine organization. Bill Gates, the biggest money supplier of those. So he calls the shots. He makes the rules. And he makes money when you get a vaccine. So was this about our health, or was this about either, one, him making more money, or him giving us vaccines that potentially can cause health issues? Nobody questioned it. Or if you did, as they said, as I talked to Coop about this, the media's in on it. They're not going to tell you the truth. The media is controlled by these maniacs that control the message. At least that's the way it seems to me. If you see something different, please let me know. But this information I'm getting at is from a you can find this on Rumble. It's called Fluvid-19. Not COVID-19, Fluvid-19. It's about an hour long, and it is chock full of information. We're just touching on parts of it. You can go to Rumble, find Fluvid-19. They're all truths there. So what Gates just said was COVID is kind of like the flu. That harms people that are elderly or have comorbidities. If you're obese like Dale and old like Dale would be a COVID potential candidate. If you smoke, those are all comorbidities. If you have diabetes, all those things, heart disease, it's comorbidities. The more comorbidities you had, the more dangerous COVID was, or you could say Fluvid was. So let's continue on.
So ugliness isn't comorbidity?
No, it's not.
Okay.
Thank God for me. So let's continue on in regards to how, because they were out to scare people into getting this dangerous vaccine. How do you scare people about it? Well, you might maybe fudge the death totals.
Yeah.
Remember when COVID came on, they had a death numbers. Oh, people are dying every minute, every second. I'm afraid. I need to go get a vaccine. It was a psych op for our country, and we failed miserably. It was a test.
It was very well coordinated.
And we failed. It was very well coordinated. Exactly, Dale. So here, I think in this next, they're going to talk about COVID deaths, difference between flu and COVID. Next clip.
Like if you look at the flu, there's a map that they had like red for a positive test of the flu during flu season, and then they showed 2020. In the year 2020, it's like a non-existent flu season.
Yeah.
It was the lowest recorded numbers of flu ever.
There's your flu last year. Here's your flu this year. Literally doesn't even exist. It's not even there. Look. And again, this is the CDC's numbers. CDC's numbers. The flu is magically gone. It's all COVID now.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death.
Yeah, do people realize that? Do you realize that, Dale?
I had gotten an inkling.
And listen, I consider you very smart. You're a sharp guy. You're not going to seem smart because you're unaware of all this. But when you're given the information, it immediately clicks with you. Hey, wait a minute.
I remember hearing certain things about somebody got in a car accident.
We're going to play that clip.
And they had COVID when they died, and that kind of, because then I started hearing things, well, hospitals got more money if you died.
Correct.
Again, I didn't ever dive in to go, is that really true?
For every COVID death, I think it was a minimum of $13,000 to the hospital.
Yeah. And so, of course, they're hey, you just got in a car accident, you passed away. Oh, I'm gonna prick your hand or whatever it is, or stick some up your nose.
Actually, maybe it says in the other clips, but and I'm spoiler alert. But if they considered that you had, it looked like you had COVID, like you had symptoms of COVID, like you had sniffles and a headache, whatever. They go, oh, you didn't have to test you. You have COVID. Just with symptoms.
Yeah. Well, if they're probably so far the biggest thing that is when Joe Rogan showed that chart of flu disappeared. And then
Right.
and now it's back.
Oh yeah.
Yeah, it's back. But for that 1 year, there was no flu.
And every year, the flu will take anywhere from, on average numbers, 30,000 to 60,000 people die a year after they catch the flu, and they have those comorbidities, as they say in the show. When you die, they don't go, oh, you died of COVID or you died of the flu. You died because maybe you had your heart had heart issues, or you couldn't breathe, or
right.
You died of pneumonia or whatever. But we have those deaths every year of the flu. Now, what can you do to scare people? Well, make every death a COVID death. Make every death a flu death. Make everything the flu. And we'll talk later in regards to the PCR test, which doesn't test anything in regards to the flu.
And the PCR test is the quote-unquote COVID test.
Correct. So play quick here, a clip from Dr. Andrew Kaufman. Go ahead.
But tests that can't even distinguish COVID from the flu.
Governments all over the world, and including the United States, sent out instructions to doctors saying, change the way you fill out death certificates. And what they told them to do is essentially attribute everything as much as possible to COVID. And so then if they had someone who died of flu symptoms, they would say, oh, well, those are the symptoms of COVID, and they put COVID on the death certificate.
So you don't even need to be tested. Oh, symptoms. Oh, hey, he looked like he was sick. That's a COVID death. So when you were looking in the top of the screen on CNN or Fox or any of these lunatics media stations, that was there to scare you into doing what they wanted, which was locking you down, making sure you don't talk to friends, making sure you don't get out. It was psychic warfare against our nation.
Are you going to get into, or is it come up somewhere along the line of why? Was it to see if we would follow to a certain extent, or what we would follow, or is there a practicing hypothesis?
Here's the thing, and that's the whole idea of the show, because I don't have answers. But so you as a viewer, you try to figure it out. We'll try to figure it out with you. We'll give you our opinions. Was it to try to control us? Yes. I talk about they want to depopulate. Are these vaccines harming people? And we'll show that in future shows where people are getting turbo cancers. They're getting myocarditis causing people die. Actually, we're going to show that in the show here. Part of this reason was to thin out our society. These vaccines also cause infertility, so there's no more kids being born. I think an underlying effect is they want to depopulate. They think there's too many of us. They hate us. They don't want us here. And that was the reason. And I don't know if I'm going to show it here later in regards to Gates, where he talks about they wanted to get everyone vaccinated, and they had to do it quick before people caught on. And there's this clip that shows him. He says, it's too late. We missed our window. We did everything we could, but we missed. So let's go back to these COVID deaths. I think you talked about people who get in an accident and COVID. Next clip.
So there are also new questions over whether Florida counties are correctly tabulating coronavirus deaths. One of the answers really surprised us. He told us that one person actually died in a motorcycle accident. And he told us that that had gone into the COVID numbers, and he had asked the state to remove that number. And when asked if it had actually been removed or cleared from that data, he said he didn't think so, he wasn't sure, but he was going to double check on that. And so that's when we started asking questions here.
Everyone who's listed as a COVID death doesn't mean that that was the cause of the death.
By this point last year, there were over 174,000 confirmed cases of flu. This flu season, look at that, has only 1,499 confirmed cases. That is less than 1% of the total this time last year.
PCR tests can't distinguish between the flu and COVID. Are we looking at that? Are we concerned about that?
We have got virtually no flu in Australia. Like last year, there is virtually no flu to be found.
They have this category of flu cases in their mortality statistics and also just the incidence of flu. And suddenly, when COVID came, the flu just disappeared.
Only one person in the entire state died from the flu.
It was unexpected and very surprising, but literally there was nearly no flu this year in the Southern Hemisphere.
In partnership with CDC and state and local governments, utilizing the surveillance systems that are available, what we just talked about, the flu surveillance system, because we no longer have flu,
The flu is magically gone.
Study the numbers in 2017 and 2018. We had 50 to 60 million with the flu, and we had a similar death rate. In the deaths in the United States were 43,545, similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home. And we don't necessarily report all of our flu tests. We do thousands of flu tests every year. We don't report every one because the flu is ubiquitous. People that die from flu, with flu I should say, it's not from flu. Their lungs were compromised by COPD. They had a heart attack 2 years ago. They have a weakened body. We aren't pressured to test for flu. But ER doctors now, my friends that I talk to say, it's interesting, when I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID?
Well, give us the answer. Money in hospitals.
Well, I did name the show The Real Matrix. Yeah. We're in a disastrous part of our world where the things that are happening don't make sense.
Who's
correct?
pressuring them?
Again, the deep state. You heard before one of the first clips of the show. The Freemasons, 33-degree Freemasons. Who are they? Can you walk around a city and go, hey, there's a Freemason, or there's a Freemason? Can you go around and say, oh, there's Illuminati, or there's the deep state, or there's someone behind who's in charge of making decisions about DEI or anything in regards to a business, corporation? We don't know those people. They are quiet. Who's behind our money supply? Who's behind our banks? We don't know those people. Who's behind it? That's the point here. You need to be aware that nothing happens by accident. People who have great deals of money, and I'm not talking about the person that has the biggest house on your street or the people that live in the most exclusive areas of town. They're just luckily they have a little bit more money than you. They don't have anything compared to the people who have money. Who can buy and sell countries that have enough money to affect and change regimes in countries. Those are the people that have the real power. And they're exerting it on us. They want to ruin and wreck and destroy America so they can put the control of America under a one world government, New World Order, and those are the people. Those are the deep state. Those are the Illuminati. Those are the 33-degree Freemasons who will then be in charge of everything. You'll know them once they take over. They're trying to take over. That's the problem. And you have to be aware of everything going on. And I'll say this in regards to what he talked about, in regards to what the CDC said, Bricks, that was that lady who was in charge of CDC, said, oh, flu went away. What? How can you trust anything the CDC, NIH, any of our government health officials say when they said the flu went away? That's asinine. How can you trust the government when they say, oh, yeah, there's no flu? And honestly, if you're voting for a representative in your area, your country, if they were in charge or they were in the government during COVID and they didn't stand up and say, we don't need to do this, they're stupid and they need to be voted out. Everybody needs to be out. Everybody. They're not that smart, unfortunately. That's just one man's opinion. I mean, if you've been lied to again and again by someone, how can you trust them again? And that's what's happened to us. I want to play some quick about the PCR test, the test in regards to what it said. Oh, you're sick, locked down, stay in the house, never leave again. Next clip about the PCR test.
You know, the PCR is just completely invalid because even if it did work as a test, well, what are you measuring? Because the only way to develop a test to measure a virus is to first demonstrate the virus and then find some part of it that you can measure more easily. But the PCR test as it is completely meaningless, and it doesn't matter how many times they amplify it. That's just a way to see what they can do is they can manipulate the test. And this is why they use PCR, because it's so easy to manipulate. There are at least 3 different variables that you can tweak to change your outcome. And the governments are using the results of this test to drive the policy. So if they want to institute a new policy or initiate more fear in the public, they can tweak the test. You know, one of the ways is by increasing the amplification cycles, but there are other ways. And that will increase the number of positives.
If you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So I think if somebody does come in with 37, 38, even 36, you got to say, you know, it's just dead nucleotides, period.
The man thinks you can take a blood sample and stick it in an electron microscope, and if it's got a virus in there, you'll know it. He doesn't understand electron microscopy, and he doesn't understand medicine, and he should not be in a position like he's in. Most of those guys up there on the top are just total administrative people, and they don't know anything about what's going on the bottom. You know, those guys have got an agenda. You can't expect the sheep to really respect the best and the brightest. They don't know the difference. Who do we trust? Fauci? Fauci doesn't know enough to, you know. If Fauci wants to get on television with somebody who knows a little bit about this stuff and debate him, he could easily do it because he's been asked.
The cases are based on a PCR test which Mike Eden, former chief scientist for Pfizer, has pointed out that roughly 90% of the so-called cases are false positive. So we don't have sick people. And it was in the press this week that 86% of the positive cases had no symptoms.
That's pretty overwhelming.
Right? I didn't set up that clip very well if you go back. It shows that they tested orange juice.
Yeah.
And orange juice had COVID.
Well, maybe somebody spit some back in a cup.
Sure. Actually, I didn't show the rest of the clip. They tested bananas, kiwis, all kind of everything. Test every. If you cycle it enough, everything has COVID. Everything has whatever they're looking for. Everything. We'll hear more from Dr. Kary Mullis, the inventor of PCR, on the other side. We're just getting started in regards to COVID, Fluvid, here on The Real Matrix. We'll see you on the other side. Want to make your love life sizzle like a Phoenix summer? Summit Male Medical guarantees to help you with ED or premature issues, or we won't charge you. We've helped tens of thousands of patients here in the Valley since 2008. Please compare our most experienced medical staff and low-price treatments to anybody. If you've talked to the rest, it's time to come to the best. Put the sizzle back in your love life. 480-398-1000 or go to summitmalemedical.com. Summit Medical, love for life.